it's just even doing like a relaxation exercise, deep breathing. Some people find certain music calming. I've even had patients, sometimes I've said, if there's a smell that sort of relaxes you. I had one patient years ago tell me about the smell of coffee reminded him of being with his grandparents. So I was like, well, get a little bag of coffee. And when you're feeling kind of stressed, put a little Ziploc of coffee in your purse, open it up and just take a few deep breaths. That was very calming for them. So that's one thing that people can do to say, I'm going to do something like that. Again, get outside, some fresh air. Sunlight's very important, not sitting in a dark space and this kind of thing. Sometimes interaction with people, sometimes you have to find maybe one very close friend that say, hey, when I'm really feeling it, I can pick up the phone and call you. Other times realizing, even though we may not feel like we want to eat, even though we feel like we just can't do this, understanding for our health, it's important to put ourselves on a regimen and say, we're just going to do this, even if we don't feel like we want to. Just like sometimes we would obviously tell someone else if we saw them experiencing it. But yes, it's important to say, I can't neglect these other things. I can't neglect taking my medication. I can't neglect my other health conditions. I can't neglect my diet and activity level, because those things can put us at risk. But like I said, especially getting out, finding ways to relax, finding those things, and understanding that over time, the grief does improve.